My name is Dr. Amr MABROUK. Dua Muhammad is at the control. And yes, this is a new episode about the world of info. And today is the world of books. And today we are presenting to you 3 very interesting books, which I believe are really books that deserve to be read. The first book is Abdurrahman al-Gabarti by Salah Isa. And the second book is by Eric Topol, The Super Agers. And the third book is another interesting book about a very important issue, which is The Body Keeps the Score, Brain, Mind and Body in the Healing of Trauma by Basil van der Kolk. Really 3 interesting books that I would advise that you should relax, listen in for the program today. The world of info. And this is the world of books. And we start right away with our first book for today, which is Abdurrahman al-Gabarti by Salah Isa. Well, 2 very important characters in the history of Egypt, Salah Isa and Abdurrahman al-Gabarti. Why Salah Isa is an important person? He's a very distinguished writer, historian, and not by profession, but he was a journalist, but he was so much in depth in history of Egypt. And through all his years of working, he was interested in going through all prospects of Egyptian history, especially the modern history and the medieval history. He has always worked as a journalist, but he started having a degree from the Faculty of Social Service. And he didn't work very much as a social secretary or a social worker. He started working as a journalist from the very much beginning. He was a leftist by belief, but this did not prevent him from concentrating on the history and writing in his writings with complete neutrality, not favoring the history of the leftist over the history of the other Egyptians. So this can really be attributed to him. His book about Gabarti really was a very interesting book, because Salah Isa in this book in particular has taken the side of not telling us what Gabarti has written, but he wanted to go and tell us about the man behind the writings, the man behind these books. And this is part of the cleverness of Salah Isa in all his writings. When he analyzes a person or a personality, he goes deep into this person's story and testing his capabilities and his drawbacks and trying to give us a neutral picture of. So who is really Abdurrahman al-Gabarti? Abdurrahman al-Gabarti was a gentleman who comes from a very well-off, prestigious family living in Egypt that has been living for maybe 1 century before Abdurrahman al-Gabarti was born. And this family in particular come originally from Somaliland, and originally they are Yemeni, from the Yemeni tribes who immigrated to Somalia, and then his great-grandfather immigrated to Egypt to study in Al-Azhar, and he became a well-known scientist or a sheikh in Al-Azhar, and so did his son and his grandson after him, and they became workers and professors in Al-Azhar University. And beside that, they were having richness as working in business and commerce, and also by being secretaries of endowments. And this makes them having a very good income. Abdurrahman al-Gabarti was the son of his father. He was the only living son of his father. And therefore his father dedicated a lot of time and effort to teach him and educate him. And he has found, when he started growing up, that his father, being a scientist or a professor in Al-Azhar, had a huge library, which is of course an asset. When we talk about Gabarti himself, we know that he was born in the year 17 something, in the end of 17 1853, and he died in 1825 at the age of 72. He has written two important books. The one which is the مظهر التقديس في زوال دولة الفرنسيس, which means the good omen of the decline of the French invasion to Egypt. And the other book was عجائب الآثار, which is his main book and his main book into different volumes, which is the great interesting periods of Egypt. And if we can translate it, I mean, in a more easier way for you to understand. In the first book about the French expedition, he has written while the Ottomans, when the Ottomans came to Egypt, following the vacuum that happened when the French have withdrawn from Egypt in 1801. We know that the Ottomans and the British came in and they arranged for the withdrawal of the French from Egypt. He had written his first book with a lot of insults of the French. And why is that? Because he wanted to prove that he was not pro-French. Because during the short 3 years of the French occupation, he had, being a professor in Al-Azhar, some encounters with the French authorities. Whether it was through his friends from the dignitaries of Al-Azhar who were members of the Supreme Board or the Jam'iyya or the committee, the Egyptian committee that was made by the French of distinguished Egyptian professors and sheikhs, and being a friend of them, of these members, he became also knew a lot about the French expedition. The second point is in the final year, that is in 1801. That's the year when Abdullah Minu was the supreme commander of the French in Egypt. He became and was chosen to be a member of this committee. And therefore, after the withdrawal of the French, he has written this book, which has attracted the attention of the Ottoman Pasha and clarified his reputation from any cooperation with the French. Later on in عجائب الآثار, he has mentioned the pros and the cons of the French. He was not, of course, with the French occupation, but he has talked about, for example, important facts that happened. How they were very much interested into science, how they were very much interested in applying the law. When, for example, Suleiman al-Halabi killed Kleber, the general, they didn't just shoot or kill Suleiman al-Halabi. They made a lot of investigations, and they had a court designed especially to find out how the crime happened and what was the motives, and it clarified the reputation of Al-Azhar students who were members or living near to Suleiman al-Halabi in his quarters. So these youngsters were not condemned to death beside Suleiman al-Halabi. So for this, he has given them the sake of respect of human nature. The second important point, he was very unhappy with what the Ottomans done when they came back to Egypt, and the amount of vagabond work that happened between the Ottomans and the Mamluks in stealing the properties and the money of the middle-class Egyptians, which Gabarty was a member of this middle class and the higher middle class. So up till 1805, from 1805, when the Amr MABROUK and the rest of the dignitaries of Egypt went and asked the Topkapi to allow Muhammad Ali to be the governor of Egypt, and then started a strong relation between Gabarty and Muhammad Ali. This strong relation persisted for some time, and it has shown some decline. And this decline ended with a sort of a rift in the relation, that even Muhammad Ali felt so very much furious with the Gabarty that he has, rumors has it, that he has ordered the assassination of the son of a Gabarty to hurt his feelings and to humiliate him and make him feel very distressed. which this happened between 1817 and 1818. And really, Gabarty suffered very much from this, that he has never written a single word after the death of his beloved son, and he died in great sadness in the year 1825. However, we owe a lot to Gabarty. Sometimes people would say, does really Gabarty form a very important pillar, or is he a real historian, or is he a news teller? Actually, he is both. News teller because he definitely has taken the time to tell us about what was happening around him. And his idea of writing didn't just start at the French invasion. No, he has taken the time to write books about the period 100 years before he was born. He has taken the time to discuss the revolt of Ali Bey Kibir, the famous Ottoman governor who decided to form an independent state of Egypt, and how he didn't think very greatly about Ali Bey Kibir and admired Muhammad Bey Abu Dahab, who has betrayed Ali Bey Kibir and returned Egypt to the custody of the Ottomans. He also has written about the 100 years that preceded his birth and even preceded the governorship of Ali Bey Kibir. He has written about the endowments. He was a witness, writing a lot of information that he was seeing. But how much as a historian is he calibrated as a great historian? Well, we can stand here and look at him and we say, definitely the history is written by historians, and history is written by the bias of historians. So there are no eyewitness who can compare we can compare their witness with the witness of a Gabarty. So whatever the Gabarty is writing in his books, we will have to take him as a primary source. How does he produce his work? Definitely he's a son of his era. And as a son of his era, he has learned in Al-Azhar. He was not exposed to the European civilization except through the 3 years of the encounter with the French. He doesn't know much about the French, although he, as a good observer, started observing them and started writing about them and starting to narrate what happened in this period. So he was not just a news teller. He could give us his own opinion. He would not talk about his work or about his life, but he will just go on telling us his opinion in some people and his decision-making about other people. And this makes Gabarty really a very memorable character in the history of Egypt. Before we leave Gabarty, we have to give a tribute to Salah Isa. Not only was he a real great journalist or a writer of Egyptian history, he also was an editor-in-chief of a very important cultural journal that started as as monthly and then ended by being weekly for almost 15 years. During this period of the Al-Qahira or Cairo, the cultural newspaper, Salah Isa has given a big chance to the young writers and the young poets and the young historians to write in this journal without even caring if they are having the same beliefs in politics as he did. And this gives us a tribute to Salah Isa, who continued to write until the age of 78 when he passed away in the year 2017. So a lot to be mentioned about Salah Isa, and definitely the book Abdurrahman al-Gabarty is a book that deserves to be read. Stay tuned with us. We're coming back after the break, and we'll give you the resume of another interesting book. You're listening to The World of Info, and we're coming from Studio 3. My name is Dr. Amr MABROuk. Dua Muhammad is still at the control. And yes, this is the second book of today, and this is a very interesting book which has been just produced maybe a couple of weeks ago. It's called Super Agers by Eric Topol. So who's Eric Topol to start with? He's a very famous cardiologist, professor of cardiology, has a lot of international papers that have been published all over the world, and he has one of the most his works are one of the most cited works all over the world in cardiology and in the field of health. And he's telling us what is the definition of superagers. He's saying that once he has received a patient who was sent by one of his colleagues telling that she has a minor problem in her heart and that her age is 98 years old. So he prepared himself that he's going to see quite a frail lady, a very old lady, coming to his clinic, escorted by a lot of people to help her to come and visit him in his office. Suddenly the gate was open, the door was open, and he found a very young-looking lady who's coming totally independent, came driving to his office, has no company whatsoever, and she was completely sober. Her hearing is good, her vision is good, and she has no problems other than a minor problem in the heart that was very easily fixed. And as he took history from her, he knew that she has never ever had any serious ailment, and that she has lived with her husband until she was 94 and he was 97, and he passed away for no reasonable ailment. And after that she had a slight episode of depression, but some of her relatives convinced her that she should go to a nursing home where there is a total independence in the different apartments, but they meet in a common area. So she started socializing again and going around and having jolly good time all her life. So this is an example of very well-off, healthy lady. And he called them the welderly. The welderly meaning that they are well hygiene or well healthy old people. And the second patient that came to him, he was in the age of 84 or 85, and he is taking from his history, he proved to him that he had a lot of problems all through his life. He had cancer, and he had heart and he condition, and he had once a fracture of the femur and it was fixed. So he is a product of good, efficient, technological, high-tech healthcare. If he didn't have this proper health care, most probably he would have died in younger age. So this is what we call the elderly. The elderly are the people who are not feeling well, but they are old because they are having extra good health care. And then he gave us a percentage that says that 60% of the people above 60 or above 65 have at least one chronic disease, 40% have two chronic, and 20% has three or more. And that there is no much something called genetic predisposition, because, for example, the lady who is now 98, she has had her family or her parents have passed away in a younger age, and they never survived to such an old age. So the genetic predisposition for a welderly is not, as people think, as a leading cause for being a well or an ill old man or a lady. But definitely there are certain factors which are very important. The lifestyle. If you are exercising, and the type of exercise, we put under it an important green line. People who exercise not only feel better, but they are healthy. And there are two types of exercise. The what we call the vigorous exercise and the moderate exercise. The vigorous exercise is the one that produces increase in the level of the heart rate. For example, running or riding a bicycle uphill, or swimming. All this increase the heart rate, and this could be classified as vigorous exercise. The other exercise is trot walking or walking, and this is does not produce very much hard increase in the heart rate. However, whatever exercise you're doing is much better than doing nothing. This is number one. Number two, if you're doing vigorous exercise, then you will only take you very few. The time that you need to do vigorous exercise could be just 45 minutes, while if you are doing moderate exercise, maybe you need an hour and a half exercise 3 times or 4 times a week. So this is the good exercise that will make you or improve your lifestyle, and therefore you might live longer and healthier. The second thing to talk about is the diet. And the diet is certain subjects are really very dangerous, and this include the ultra-processed food. The ultra-processed food is like, for example, the hot dogs and all these types of food that has a lot of preservative in. They are definitely lead to metabolic disturbances. They lead to precipitation of cholesterol deposits in the cardiovascular system and the central nervous system, and of course they definitely lead to problems and carcinogenic problems. So if you avoid ultra-processed food, then you are avoiding trouble and problems. And of course, if you are eating healthy food that is a high nutritious diet in fibers, then you will avoid the cancer of the colon. The second important point is that you need proteins, because after the age of 50, there will be wasting of the muscles sooner or later. So if you are taking, should be taking 1 gram protein per kilogram body weight, maybe you would need to increase it to 1.4 gram protein per kilogram body weight as you get older. However, you are not exceeding the limit of the protein so that we don't have gout, and the sources of protein can be variable. Not necessarily they should be not always meat, or but chicken is better. Fish is definitely better, and even some of the vegetarian protein, plant proteins is also helping beside the animal protein. So then we talk about the sweeteners. The sweeteners, of course, the glucose is very dangerous. Aspartame is less dangerous, but definitely it is not that as healthy as people think. Stevia is much better than aspartame. Salt, and of course we know what is salt. Salt is definitely a very bad thing, because definitely it increases blood pressure. So we have to have a balanced diet between carbs, proteins, and fats. We have to reduce the amount of protein that we are taking and to increase the amount of plant and vegetables and fruits that we are taking, because this will lead to low inflammation, and lower of the inflammation in the whole body will definitely prevent the wear and tear that can happen. How about caffeine? A moderate amount of caffeine is very good. The fasting techniques, of course, definitely helps in controlling the weight and helps to sharpen the metabolism of the human being. Alcohol is a waste of health, and there is nothing called that red wine is very good in saving your arteries. No, this is not correct. If you are aiming for the antioxidants in the red wine, you can take grape juice better. Supplements. There has been words going around giving supplements, but of course, sometimes in older age you might need supplements because of reduced absorption in the GIT. AI is still in the beginning, but definitely it can help you in writing a good diet that you should follow. The second important thing, which is sleep. Deep sleep for 7 hours definitely prevents wear and tear, reduce the inflammation, allow the brain to clarify the toxins inside it through the CSF. So people who sleep well definitely will live well, and become from the group of the elderly. And therefore, they are very important to have a good sleep, a good night's sleep. Then we reach the very important task of the environmental toxins. Environmental toxins are a lot of things that we wrongfully eat. For example, and eat and drink unnoticeably, like for example the plastic. And therefore, this is, you cannot trace, but any percentage of it can be really carcinogenic. Another important point is socialization. Social isolation leads to depression, and depression reduces and inhibit the immune system. Therefore, the more important thing is to live in a good life with a lot of social interaction. Definitely this will lead to increase life span and healthy lifespan. Loneliness increases the incidence of suicide, and definitely 23% increase of all-cause mortality happens in lonely people. there is a 23% increase. So eat good food, take care of your weight, don't smoke, and play athletics, and no alcohol. You will definitely have a longer 17 years of life. The healthy lifestyle, exercise and food, and no salt and no alcohol and no smoking and no loneliness and sleep, this analyze what is known by a good life. Now then we go to the chronic killers. The chronic killers are the obesity and the diabetes. Of course, the more you put weight on your joints, the more these joints will pass into wear and tear. The more times there will be inflammatory reaction instead of healing reaction. And therefore the amount of fat is very dangerous, and it can reach the circulation and cause a lot of emboli and thrombi. There is definitely increase in the level of, when there is an increase in level of fat, there will be less sensitivity of the cells to the insulin, and therefore the pancreas will hurt itself trying to produce insulin, and at the same time not able to burn this fat. Therefore the diet control is very important, and the GLP-1s, that is like the Ozempic and all these stuff, can really be very effective in leading to reducing of the weight. It has its own risks, like sometimes patients have had optic atrophy or pancreatitis, and of course loss of muscle tone. All this is less dangerous than the dangers of having extensive weight. The new drug, which is Wegovy, is definitely getting better results than Ozempic, because it is the same molecule like Ozempic but has the double dose, and therefore it can really improve the obesity and reduce its time. So what is the metabolic syndrome, which is increased blood pressure, increased waist, and increase the fasting blood sugar? All this really is like a time bomb. How to use the lowering fat drugs, introduce the fats, of course, like the statins. This really can improve the condition. The second important killer is, after the diabetes and the obesity, is the cardiovascular diseases. Therefore, people have said that you should take aspirin. It's not that proved, and instead aspirin could be sometimes unnecessarily dangerous, with causing a lot of risk. So the cardiovascular diseases happen when the diabetes is there. There will be precipitation of cholesterol deposits in the vessels, leading to increase in the blood pressure. Of course, if there is smoke and leading to constriction of the vessels, and increased glucose, and the smoking increase the level of cholesterol, all these things are definitely needed to be managed. Sometimes colchicine is advised to decrease the inflammation and helps in the really living. The atrial fibrillation, of course, is one of the things, and then we talk about cancer. Cancer is one of the most important killers of human beings. How, if you avoid cancer, and especially the metastasis of cancer, life can get longer and more happier if you have the time to do that. So how can we do this? Definitely by early diagnosis and by avoiding the causes that cause cancer. The last but not least is Alzheimer. And Alzheimer is, if you can really diagnose how Alzheimer happened, and through certain genes and through types of proteins, then you can diagnose the early occurrence of Alzheimer, and you might even reverse its occurrence. Another debilitating neurological disease is Parkinson's disease. And of course, exercise and getting away from pollution and taking some caffeine definitely helps to stop the progress of Parkinson's disease. So there are a lot of rare diseases that can really affect the lifespan and of human beings. The rare diseases can affect maybe 10 million of the population of the world. So what is rare is actually not that rare, as you can see. So the development of new vaccines for certain viruses, producing virus like the Epstein virus, and vaccines for MS, definitely will promote the healthy life and promotion of the mental health. Well, this is really an interesting book. It's really full of a lot of medical information that might make it difficult for you to understand and read, but definitely it deserves to be read. It deserves to be cherished, and at the same time it deserves to give you an idea that healthy life is at the fingertips of your hand. If you avoid bad habits, if you avoid bad food, and if you go out of your way to play sports every day and take care of your good health, definitely you live longer and better, quality and quantity. An interesting book called The Super Ages by Eric Topol, a book that deserves to be read. So after the break, we go to the world of info, and today is the world of books, and this book is the third book today, and really this is an interesting book. It has been in the market for quite some time, being maybe 11 years ago it has been produced, and it's still ringing a lot of bells, and still a lot of people are interested to understand it and to elaborate on it. And the book is called The Body Keeps the Score: Brain, Mind and Body in the Healing of Trauma by Basil van der Kolk. And this book talks about trauma. And trauma is the distress or the post-traumatic stress disorder. And it analyzes the fact how we can diagnose the post-traumatic effect of the trauma, and what are the people who suffer from that, and how to find a solution to help them. It's a very sophisticated book. Definitely anyone who reads this book will definitely has to have a degree in medicine. Although it is one of the New York Times non-fiction best booksellers, yet it seems that a lot of people have bought this book, try to understand it, because it is severely and definitely related to a lot of the lives of Americans and of the whole world. When we talk about trauma, let's talk about first the author. The author had a degree from Harvard in medicine, and he's a psychiatrist. And he enrolled in after graduating from the Faculty of Medicine, he enrolled to work in the Veterans Association in their hospital, and this was in the late 70s. As a psychiatrist who was just found a new job, he found out that a lot of veterans who are come back from Vietnam. Vietnam has ended in 1975, and the last Americans who left Vietnam maybe in 1973. So, except of course for the very few people who were still serving in the American embassy in Saigon. So 7 or 6 years later, after the last withdrawal of the Americans, still he was receiving, and the veterans hospitals was receiving people coming with severe anxiety, severe depression, severe inability to cope, and being triggered very easily into fights with the nursing staff, with the physicians in charge, with their whole life. And this is what we can call the incident is stuck in the memory. So he starts the book by telling us the story about Bill, or about Tom. Let's talk about Tom for the beginning. Tom was a Vietnam veteran who his father was also working enlisted in the army during World War II, and Tom found it as usual as a family tradition he will enlist in the army. He went to the army in 1965 and served in the Marines, and as he was serving there, he was involved in one of the missions, and during this mission he had a very close friend with him in this mission, and he was the commander of a platoon, and suddenly they had fallen into the hands of an ambush. And in this ambush he lost almost all of his platoon. He was the only survivor, and he has seen his best friend losing his life and completely his body destroyed in front of him. He couldn't get this out of his mind or out of his memory. And he later on said that on the second day, or within the same week after this extensive ambush, he acted merciless on an attack on one of the Vietnamese villages, where he himself has done a lot of atrocities that he is very ashamed to describe even to the psychiatrist. And he said that after coming home, he started trying to get his life together. He went to the law school, he became a lawyer, and he started his own office as a lawyer, and he became distinguished. He got married to his sweetheart, have 2 children, but every once in a while, which is very common to happen, he would have a bout of flashes of the bad memory of what happened to him in Vietnam, and he, as if he sees it again. And if he hears, for example, the fireworks of 4th of July, he becomes severely agitated. He would even try to have a lot of fights with his family, with his wife, and with his own children. He might go into bouts of drinking alcohol or riding his Harley Davidson in a maximum speed, in what we can call suicidal tendencies. All this is severe post-traumatic stress disorder. But at the time of the 70s, this was not dignified as such a syndrome or a disorder. And at the same time, he decided to open the practice and the clinic to receiving other victims. And so he received another gentleman who was a paramedic. So he was not carrying weapons, but he has seen injured Vietnamese children and women, and injured American soldiers who died in his own hands when he was trying to save them. And this thing was stuck in his memory, especially when he had when he came back. He married, and his wife had a child, and he was stuck with the child to take care of him. So this experience of his was leading to what we can call really numbness or unexplained reactions that he doesn't want to talk about, and he only talks about after being extensively approached by the psychiatrist to try to find a solution for this problem. So it took time until in 1980 the post-traumatic stress disorder has been accepted as a term for the competence coming from war. Then we take a full stop, because at that time the writer or the physician decided that he will leave the Veteran Association, claiming that he was not having a free hand in management of these patients, and not a free resources were not given to them. So he went back to Harvard, had a clinic, and he started his work and practice until he became a professor of psychiatry. And he did great work there. It was known at that time that he was interested in working with veterans, and so veterans not only of Vietnam came to him, but veterans of World War II, who told him that their life has very much changed after the stresses that they've been subjected to, how far they have these flashbacks, how far they feel the numbness, they feel the solitude, they feel the anger, they feel the rejection. All this can be hardly approached. And he said that as he was working now with civilians, so he started having victims of other stress or shock or trauma. For example, the incest and the child abuse. They were a majority of children were coming with this. And of course, there is definitely other things, like, for example, women and men couples who have fights together, and there is a vigorous abuse by one of the partners, even the woman who is fighting or beating up her husband or vice versa. All this has put the partners and the children into severe stress. So the post-traumatic stress disorder is not just for combatants or for victims of war. And he started to know and analyze that the victims who look to be victims of anxiety or of other mental illness are actually patients who are suffering from the post-traumatic stress disorder, and therefore they needed all his attention. So he tried to analyze what is this trauma causing, and he said, let's talk about the brain. The brain is response to trauma. We have to classify our brain into three parts. We have the reptilian brain, or because the brain of reptiles, and this is including the brainstem, which is the survival instincts. Like a reptile, when he's approached, he will fight and flee, and therefore he will go out. So if the trauma happens to somebody, and he will go to the reptile status, which is withdrawal, and becomes stuck in this numbness. He would be like a reptile trying to escape and to fight with his increased heart rate. Then there is the mammalian brain, which is the limbic system, and this is when he feels the fear, the memory starts going on, the sensory affection, and therefore the victim suffer from oversensitivity for this reaction and have a lot of suffering. And of course the last thing is the human brain, because all these sections of the brain, we have a reptilian part of our brain, is like a reptile, another part that of the mammal, and the other thing which is the human brain, which is the neocortex. And this is reasoning in trauma, where you can become showing a lot of impulsive behavior when you remember the trauma that you have passed in. They have difficulty in processing the trauma and dealing with it, because you're seeing it every day and you cannot escape from it. And therefore, this is the fact that the animal will override the human. So how does the trauma get stuck in the body? And this is very interesting. When you get social engagement, you cannot connect with the people because you are still seeing the trauma and living the trauma every day, so you are going to loneliness. You are going into the fight and the flight continuously, so you are always exhausted and panicked. And therefore sometimes you are even dissociated or frozen or the freeze collapse. No wonder that this was sometimes misdiagnosed as schizophrenia, or the people who are suffering from severe autism, while all this is definitely another thing. He has presented in his book a lot of case studies, the veterans that I've just described, the abused child, and the man who has suffered from a lot of severe somatic disorders, and then when he clarified that, he found out that he has been abused when he was a child. So the psychosomatic disorders that he's having in his lower back pain are just related to his bad experience in life. So can we treat this with talking or psychological sessions or counseling? And this the writer begs to differ and say that this will not really read, because he has tried very much to open up these people to the trauma and to tell them about this story, but sometimes the people are shut up and they don't want to the counselor or the psychologist to penetrate their walls and let them remember or tell the story of how they are living during the trauma, after the trauma, and how can they survive. But of course, this is one of the taboos of the book, because a lot of authors later on said that this is not right. You could have easily worked with this talking. He said that there are other examples that, like the like eye movement test, the yoga, the meditations, the exercise, and some psychedelic drugs. All this can definitely help in improving and treating the post-traumatic stress disorder. He's finishing his book with telling us the stories of the dark side of trauma. The people try to treat themselves, and that's why they get addicted to alcohol or drugs, trying to treat themselves. Sometimes they are misdiagnosed and go into the series of mental illness although they were all completely normal before the trauma has been inflicted to them. Of course, the soldiers and the combatants and the veterans can be easily diagnosed, and this can be attributed to it, while the other things, they are not given this idea. And of course, sometimes they do self-harm, and they treat, and symptoms are only treated instead of treating the disease itself or trying to find the cause. The book is interesting. The book has a lot of neurological information that can keep you always living under the hell, and you don't really know how it goes on. But definitely the book. With this, we come to the end of our program today, and I think there are 3 books that deserve to be read. Today we have presented 3 interesting books, and they are really some of the bestsellers. First, from Egypt, the book of Abdurrahman al-Gabarti by Salah Isa, a very interesting book dealing with the history of Egypt, or modern Egypt. And the second book by Eric Topol, that is The Super Agers. And the third book, a very interesting, controversial book about the body keeps the scar, and this, of course, the brain and the body in the healing of trauma. This is an interesting book by Basil van der Dirk. This was the World of Info, and today was the World of Books. With you was Dr. Amr MABROUK. Dua Muhammad was at the control, and looking forward to see you the same time, same station. And please always stay tuned to radio.